केसेस फॉर ट्रीटमेंट हो गए, जैसे कि proper selection of cases, avoid pitfalls during endodontic treatment and help to ensure success. Not every tooth is suitable for endodontic treatment. Errors in case of selection, some of which could have been avoided, constituent of 13 to 22% of failure reported in a study by Engel and Beveridge. Many more root canals are treated today than before because of greater interest in endodontic by the practitioner, not only to save endodontically involved tooth but also to use them to abutment for bridges or partial dentures. Unfortunately, a general practitioner's best effort may not be good enough because for mistaken diagnosis such as a curved canal not capable of being instrumented to the apex with the resulting persistence of the area of rarefaction. On the other hand, certain cases formerly contraindicated for endodontic treatment, such as a sinus tract discharging into the gingival sulcus, are treated successfully today because of the advances in both endodontic and periodontal therapies. To depend on root canal treatment alone for all endodontic cases is bound to meet with a certain degree of failure. However, MTA, जैसे कि mineral trioxide aggregate, induce the formation of a calcific barrier in root canals with the open apex, or use of periapical microsurgery to remove the periradicular pathologic tissues on possibilities of being successful are high. On the other hand, microsurgery is not indicated simply because an area of rarefaction is present. तो इसमें कहता है कि the clinical should be consider the following factors that influences the outcome of the treatment. Health and systemic status of the patient हो गया, anatomy of the root canal system हो गया, extent of previous tooth restoration हो गया, presence or absence of periradicular pathosis हो गया, radiographic interpretation हो गया, degree of difficulty in locating, shaping, cleaning and obturating the complete root canal system, periodontal status of the tooth, presence of crown and root fracture, presence of root resorption हो गया, patient desire, motivational cooperation and pain threshold, clinical skill and expertise for the operator, advance in the understanding of the endodontic better technique and principle of canal preparation and obturation have led to significantly increase predictable healing rates for the endodontic treatment, 95% and higher.
जिस कॉलेज से वो पास की है ना पीजी, वहाँ बहुत स्ट्रिक्टनेस से पीजी को भी लगता था, इसलिए क्या पीजी को भी वैसे ही एकदम है। तो नाम बहुत मैम स्वीट है, तुम लोगों को पढ़ाती है कि नहीं पढ़ाती?
Recommendation regarding prophylaxis for bacterial endocarditis. Endocarditis prophylaxis recommended जैसे preventive antibiotics prior to a dental procedure are advised for patient prosthetic cardiac valves, certain specific serious congenital on birth heart disease including unrepaired for or incompletely repaired cyanotic congenital heart disease, as well as those with palliative shunts and converts, completely repaired congenital heart defect in prosthetic material or device.
हम रखते हैं ना पीरो में, तो हम देखते हैं कितना दिक्कत वैसे नहीं देगी तो आधा उनको गायब रहता है, आधा टाइम वो गायब रहता है। नहीं अगर ऐसा रहता कि इस कॉलेज में आ जाए तो कॉलेज यही निकल जाएगा।
Supernumerary roots. Extracted specimens of maxillary, third molar and demonstrating the extract area with mixed delacerations. A pulp stone occupying almost the entire pulp chamber and root canal. Subgingival decay of a crown हो गया, den invaginatus हो गया, germination हो गया, extent of root canal obturation in an endodontically treated हो गया. The AAE has developed a practical tooth tool that makes case selection more efficient, more resistance, easier to document, endodontic case difficulty assessment form again intended to present practitioners with endodontic treatment हो गया. Planning but can also be used to help with referral decision and record keeping. The assessment from identify three categories of consideration which may affect treatment complexity जैसे कि patient consideration हो गया, medical history हो गया, patient complaint, medical history हो गया, anesthesia हो गया, patient के positioning, mouth opening, gag reflex हो गया, emergency condition हो गया, diagnostic based treatment consideration जैसे diagnostic radiographic difficulties, position in the arch, tooth isolation, morphologic aberration of the crown, canal and root morphology, radiographic appearance of the canal, एडिशनल कंसिडरेशन हो गया जैसे हिस्ट्री ऑफ ट्रामा हो गया, हिस्ट्री ऑफ एंडोडोंटिक ट्रीटमेंट हो गया, पेरिडोंटल एंडोडोंटिक कंडीशन हो गया. विद इन ईच कैटेगरी लेवल ऑफ डिफिकल्टी आर असाइंड on the basis of potential risk factor. The level of difficulty are set of conditions that may not be controlled by the dentist. Each of the risk factor can influence practitioners' ability to provide care at a consistently predictable level. This may impact of appropriate provision of care. Quality assurance for each level of difficulty guidelines are given to aides. The dentist in determining whether the complexity of the cases is appropriate for his her experience or comfort level. Guidelines for using the AAE endodontic cases difficulty assessment form. लेवल ऑफ डिफिकल्टी हो गया, मिनिमम डिफिकल्टी हो गया, प्री ऑपरेटिव कंडीशंस इंडिकेट्स रूटीन complexity uncomplicated. These types of cases would exhibit only those factors that are listed in the minimum difficulty category. A predictable treatment outcome should be attainable by a competent practitioner with limited experience. Moderate difficulty. Use of endodontic case difficulty assessment form. जैसे कि in order to make the case difficulty जैसे assessment form a more objective exercise, it is recommended that a point score is assigned to each item with each difficulty category. This point system is offered for educational purpose only and is not recommended for clinical practice. The following score ranges are recommended in making the decision whether to treat or refer. Less than 20 points dental student may treat. Level of faculty supervision should be tailored to the student level of experience. Endodontic treatment outcome क्या होता है? According to Friedman, the assessment of treatment outcome in endodontics should be classified as जैसे कि healed, that denotes complete clinical radiographic normalcy. Category also include typical appearance of a scar after apical surgery. Healing, this denotes a degree in the size of radiolucency and clinical normalcy after the follow-up period shorter than 4 years. Disease indicates that the presence of radiolucency जैसे कि डिजीज हो गया रिफ्रैक्टरी करंट अपाइकल पेरिडोंटाइटिस हो गया. दिस इंडिकेट द प्रेजेंस ऑफ रेडियोल्यूसेंसी न्यू इंक्रीज एंड चेंज द रिड्यूस आफ्टर ऑब्जर्वेशन. द वेरियस फैक्टर इन्फ्लुएंसिंग हीलिंग आफ्टर एंडोडोंटिक ट्रीटमेंट कैन बी क्लासिफाइड एज जैसे कि प्री ट्रीटमेंट वेरिएबल्स, प्री ट्रीटमेंट वेरिएबल्स, पोस्ट ट्रीटमेंट वेरिएबल्स. Presence of periradicular radiolucency. The presence of pre-treatment periradicular radiolucency has a strong negative influence on the healing. potential following non-surgical endodontic treatment. Majority of teeth have shown a poor outcome in teeth affected by apical periodontitis. The pulpal stretches does not affect the healing potential of endodontic. Vital and non-vital tooth heal similarly in teeth without apical periodontitis. Presence or absence of clinical symptoms does not influence the healing potential. Copious irrigation with irrigants such as sodium hypochlorite play a crucial role in intracanal disinfection. Shaping of the canal to an appropriate size that would facilitate the placement of a small gauge irrigation needle in a critical apical third of the root canal has a significant role in achieving clinical access. Canals that exhibit serious drainage should not be obturated in a single sitting, and intracranial medicament such as calcium hydroxide should be employed. Persistent drainage split of manipulate apical applications of the intracanal medicament. पोस्ट ट्रीटमेंट हो गया देखो जी. Lack of judgment in accepting a tooth for treatment because of either operative difficulty or poor health for the patient. Missed root canal, lack of adequate disinfection and debridement during canal preparation. Failure to disinfect the root canal due to poor clinical protocol. Infection in accessory canal with failure to disinfect them. Comprises a small percentage of cases with imperfect root canal obturation, failing to seal off the apical foramen, foreign body reactions of a overfilled canal, extraradicular microbial infections such as actinomycosis to apical cyst lesion, vertical root fracture हो गया, poor periodontal health leading to mobility of tooth, poor coronal seal leading to infections of the root canal space, traumatic injury leading to tooth and tooth fracture. Endodontic and prosthetic treatment. इसमें कहता है कंसिडरेशन एंड वारंटिंग रिमूवल ऑफ टूथ. वारंट हो जाता है रिमूवल ऑफ टूथ, जैसे कि सिम्टोमेटिक टूथ इन विच कैनाल्स आर नॉन निगोशिएबल. मतलब ऐसा कोई टूथ है जिसका कोई कैनाल जो है वो निगोशिएबल नहीं है ड्यू टू कैल्सिफिकेशन की वजह से कैनाल नहीं मिल रहा है, और एट्रोजेनिक errors and whole surgical management is not feasible. तो endodontically treated tooth exhibit failure which is not amenable to either non-surgical or surgical treatment. Irreparable fracture of tooth, extensive periodontal disease with loss of bone support and causing irreversible mobility of tooth. Under no circumstances should endodontic treatment be dictated only by strategic need for the tooth. Informed consent हो गया, जैसे endodontic and single tooth implant हो गया. Magnification of endodontics हो गया. Endodontic procedure inside the pulp chamber and root canal system requires high level of precision. Performing endodontic therapy is like working inside a blind space, wherein procedures are traditionally done by tactile sensation with the help of radiograph. The greatest challenges a calcium faces while trying to achieve clinical perfection is and trying to visualize the operating site with clarity. This is not possible beyond a point due to the inherent limitation of the human visual space. The advent of magnification aids has greatly revolutionized dentistry and especially endodontic either using a dental loop or preferably employing a dental operating microscope, can achieve enhanced visualization in clinical dentistry. Introduction of DOMS has revolutionized a new era in endodontics. Lupus can be classified by the optical method in which they produce magnification, and also based on how their lenses are mounted on the frame. डेंटल माइक्रोस्कोप ऑपरेटिंग माइक्रोस्कोप है ये डेंटल ऑपरेटिंग माइक्रोस्कोप है mobility of lens adjustment of the optic parts of the body of microscope how the operating microscope work जैसे कि टॉप ये माइक्रोस्कोप सर्जिकल ऑपरेटिंग माइक्रोस्कोप है मैग्निफिकेशन illumination documentation mounting and microscope magnification increase and the field of view decrease by any one of the following variables increase the power of eye places increase the focal length of the binoculars increase the magnification factor फ्लोर स्टैंड हो गया वॉल स्टैंड हो गया हाई वॉल माउंट हो गया सीलिंग माउंट हो गया इस तरह से इसको करते हैं देखो क्लिनिकल एप्लीकेशन होगा द यूज ऑफ DOM डिजिटल occlusal and mesial enable a clinical to perform a wide variety of complex clinical procedure is a very comfortable posture. It is also enable a clinical to visualize the area of interest in various level. Principle of endodontic treatment क्या है? The basic principle underlying the treatment of tooth with endodontic problems are those underlying surgery in a general and aseptic technique जैसे कि debridement of the wound, drainage and gentle treatment of the tissue with both instrument and drugs. All are cardinal principle of surgery. Specifically, pain must be controlled with the help of local anesthesia. During treatment, all pulp tissue must be removed. The root canal enlarged and irrigate the pulp space disinfected and the root canal well obturated to prevent the possibility of reinfection. जैसे कि देखो लोकल एनेस्थीसिया हो गया at the start of root canal therapy at the start of root canal therapy local anesthesia is used. Anesthesia should not be administered without the thorough knowledge of patient medical and dental history. Any prior allergic reactions or untoward episodic during dental treatment must be investigated and evaluated to avoid any future reaction to medication. The most commonly employed anesthesia हो गया the most commonly employed anesthesia agent in endodontics are as follows जैसे 2% lidocaine हो गया with 1:1 lakh epinephrine. It is the most common employed local anesthesia or agent. 2% lidocaine with 1:1 lakh epinephrine हो गया या उसके 0.5% bupivacaine with 1:2 lakh epinephrine. Prilocaine with not commonly used. इन्फिल्ट्रेशन एनेस्थीसिया हो गया जैसे कि the Committee on Medical Education of the American Heart Association and the Council on Dental Therapeutic of the American Dental Association have approved a report of a conference at which it was stated that the concentration of vasoconstrictions normally used in dental local anesthetic solutions are not contraindicated in patients with cardiovascular disease when administered carefully with preliminary aspiration. ब्लॉक दिए हो. Infiltration anesthesia हो गया. Infiltration anesthesia is the injection of a local anesthetic into the soft tissues into the region of root apex. This technique infiltration, तो इन्फिल्ट्रेशन एनेस्थेसिया जो होता है इसमें हम क्या करते हैं कि लोकल एनेस्थेसिया को सॉफ्ट टिश्यू में इंजेक्ट करते हैं और इन द रीजन ऑफ रूट अपेक्स यानी जिस दांत को के ऊपर काम करना है उसके जस्ट रूट पोजीशन पर, रूट अपेक्स पर जस्ट उसके रूट अपेक्स की तरफ इसको इंजेक्ट करते हैं. दिस टेक्निक इज प्रीफर्ड टू अचीव एनेस्थेसिया फॉर एनी ऑफ द मैक्सिलरी टूथ. किसी भी मैक्सिलरी टूथ में हम ये कर सकते हैं. तो इन्फिल्ट्रेशन इज प्रोबेबली द सिंपलेस्ट, सेफेस्ट एंड फास्टेस्ट मेथड ऑफ प्रोड्यूसिंग एनेस्थेसिया. इन्फिल्ट्रेशन मेथड जो होता है ये सिंपलेस्ट होता है, सेफ होता है, फास्ट मेथड होता है प्रोड्यूसिंग एनेस्थेसिया फॉर रिमूवल ऑफ डेंटल पल्प. द इंजेक्शन ऑफ एन एनेस्थेटिक स्टॉप any pain and makes pulp removal possible. The injection is made as for removal of tooth. One insert the needle into the mucobuccal folds. Mucobuccal folds. Insert the needle into the mucobuccal fold slightly mesial. Mucobuccal fold में जो है म्यूकोबक्कल फोल्ड में देना है, ठीक है. और स्लाइटली मेजियल ऑफ द टूथ ऑफ एनेस्थाइज. जिस टूथ को एनेस्थेसाइज करना है उसके मेजियल की तरफ स्लाइटली मेजियल होना चाहिए और बक्कल फोल्ड में होना चाहिए. To be anesthetized and carry it towards the root apex until bone is encountered. An effective long-lasting anesthetic solution 2% lidocaine xylocaine with 1:1 lakh epinephrine is preferred. Though other local anesthetics are also effective, generally 1 cup carpals of anesthetic solution 1.8 ml is sufficient, but administration of more anesthetic solution is often required for pulp extirpation than for extraction of tooth. Despite care in injection, complete anesthesia may not follow. Anesthesia may not